Tuskegee University is among 8 historically black colleges and universities to receive millions of dollars to develop and deliver COVID-19 testing on campus.
It's a real collaboration between Thermo Fisher and Tuskegee. Thermo Fisher is providing all of the test kits and reagents for us to be able to test for the virus on campus.
It's called the JUST Project, named for Ernest Just, pioneering scientist and one of the founders of Omega Psi Phi Fraternity Incorporated. Through the program, Thermo Fisher hopes to make available more opportunities for testing in African American communities. What's more, the university will be able to run over 500 samples daily and turn results around in 24 to 48 hours.
Putting the testing resource in a place like Tuskegee University not only serves the university population, it serves Macon County and other black belt counties who also have the lack of testing as a severe issue.
Black and brown communities are disproportionately affected by COVID-19, and with the cold and flu season upon us, testing and knowing your status is key. Tuskegee will be using the gold standard for diagnostics, the reliable PCR test.
When you get a positive result from a PCR test, you are sure that that is a positive. And when you get a negative result, you are sure that that's negative, and that's just as important. We have so many asymptomatic carriers. We do not want them out there thinking that they're negative and continuing to interact and not taking the precautions of being in quarantine when they really are positive.
And that's not all. During this pandemic, Tuskegee has been leading in the area of diagnostics. The university has been producing the viral transport media on campus for months.
We started making test kits, which we could do, to service the community and then pass those out to the local health authorities in order to be able to supply the needs of the community.
Over 3,000 vials have been created on this campus and not only distributed to our campus environment, but to other black belt counties.
Tuskegee will be able to run the tests on campus. But for the program to be successful, the community must have trust. Medicine and minorities have a difficult history. That's why Tuskegee is committed to moving forward with ethics and transparency at the forefront.
Because we understand that with this history, especially if there's going to be an inoculation or immunization coming out, our community is not going to hear and want to go and take that unless they can be sure that it's something that's going to be helpful and not detrimental.
And so just being on Tuskegee, what we're calling holy ground, that's in our minds every day as we move forward. Our job here as a scientist and director of our Center for Biomedical Research is to make a case over a number of years that we're ethical, we do right research, but we are going to bring it back and that you can trust us.
Hello, and welcome to today's panel discussion on the political response to COVID-19. It's being brought to you by the students in the Integrated Public Policy and Development PhD program, as well as the Departments of History and Political Science, Social Work, Biology, Pathobiology, Agricultural and Environmental Sciences, and additional units at Tuskegee University. I am Dr. Dolores Alexander. I'm a professor in several departments at Tuskegee. I have a 30-year background in microbiology and infectious diseases, the BS degree in biology from Alabama State University, a master's degree in environmental science focusing on bioremediation from Tuskegee University, a PhD in microbiology from Meharry Medical College, specializes in tropical diseases, and postgraduate work from the University of North Carolina at Chapel Hill. Since the beginning of the COVID-19 pandemic, I have also been working with several groups at Tuskegee University and personnel from the Alabama Department of Public Health on community engagement initiatives related to COVID-19, in particular as it relates to underserved communities. Today, we have an exciting group of panelists who will share their thoughts on where we are with COVID-19, what the political response has been to the pandemic, and what we've gotten wrong so far, and where we should go from here. So joining us today in the order of appearance are Theo M. Moore II, who is from Anniston, Alabama, where he attended Anniston High School. After completing high school, Moore began exploring his passion for history at Troy University in Troy, Alabama. At Troy University, Moore earned a BS degree in history and a master's degree in post-secondary education, also focused on history. Currently, Moore is a collections manager at the Legacy Museum at Tuskegee University and a second-year PhD student in the Integrative and Public Policy program at Tuskegee University. Moore's dissertation will focus on the representation of African Americans in Alabama's social studies curriculum. And lastly, Moore serves as the executive director of Historical Vision Production, where he oversees the nonprofit organization's operation. So Mr. Moore is a historian, he's an educator, he's also a short film documentarian. Next, we'll have Monye Shavers. Monye is a second-year doctoral student in the Integrated Public Policy and Development program at Tuskegee University. She received her master's degree in political science from Howard University, and where she majored in international relations with a minor in Black politics. Monye explores the dynamics of land policy and food security. She is also interested in the intersectionality between climate change, migration, race, and gender. She is also a Tuskegee University Cooperative Extension Program intern, working in the area of research and development as part of the Carver Integrative Sustainability Center at Tuskegee. Candace Clark, also known as Ken Doe, is a Southside Chicago native and graduate of the Piney Wood School. She's also a graduate of Tuskegee University, American University, and the United Nations University for Peace. Ken Doe hopes to empower developing communities by connecting ag and the culture of agriculture to her generation and her culture to the world through regenerative and holistic practices. She is a farm plug, a sustainable agricultural educator, and an intersectional advocate that cultivates. Using her experiences, she hopes to break down barriers by helping to develop and increase the capacity of her neighbors while simultaneously encouraging ag representation and intersectional justice. She is currently enrolled in Tuskegee University's Integrated Public Policy and Development PhD program. And then finally, we'll have Febru Holston, who is also a PhD student in the Integrated Public Policy and Development program at Tuskegee. She is an instructor in the Department of Social Work, which is part of the College of Arts and Sciences at Tuskegee University. And she not only has an interest and expertise in public policy and development, but she's also been one of the leading proponents of mental health education, support, and training at Tuskegee University, and a leading voice in suicide prevention. She was born in Fayetteville, North Carolina, but lived in many places. And she has an earned BA in sociology from Fayetteville State University, a master's in social work from the University of Georgia. But she's been a longtime resident of Tuskegee, Alabama, and now considers Tuskegee her home. And with that, we will start with Theo M. Moore II.
All right. I'm happy to be here, and so I'm just going to jump right into it. So as a person who has lost a loved one to the coronavirus, I want to say that this virus is real, and I ask that everyone please act responsibly when out in public to protect yourself and others. My presentation will focus on Alabama's response to the COVID-19 pandemic, which took a detrimental toll on Alabama citizens socially, economically, politically, and culturally. However, the state's leadership, led by Governor Kay Ivey, response to the pandemic has been strategic to prevent a rapid decline of the state's economy. In other words, the practice of capitalism has been influential to how policymakers responded and are continuing to respond to the COVID-19 pandemic. Since the coronavirus's first confirmed case was discovered in Montgomery County, instead of closing businesses completely to ensure citizen safety, Governor Kay Ivey issued a statewide health order that prohibited gatherings of more than 25 people. In March, the state government temporarily closed schools, beaches, and non-essential businesses with hopes of reopening due to the amount of money these institutions accumulate for the state. In April, Alabama reaches 1,000 confirmed cases. In response, Governor Kay Ivey issued a statewide stay-at-home order until April 30th, and then extended it until May 15th, a few days before the April 30th deadline. Also in May, the governor allowed close contact businesses to reopen. During this time, the state reached 10,000 confirmed cases, and Montgomery County, home to the capital, is the most infected county in the state. Numerous reports highlight that African Americans are at higher risk of being infected with COVID-19, and once infected, having worse outcomes. Living in neighborhoods with environmental issues, reliance on public transportation, and crowded housing conditions in some African American communities contribute to this increased risk of obtaining COVID-19 among this population. Also, there is a minimal access to care because of transportation and financial barriers that increase the likelihood of poor African Americans who get infected. Lastly, there is a trust barrier between African Americans and medical institutions, mostly predominantly white. Why is there a trust issue? I want to answer this question with the name of one of the most inhumane studies in American history, the United States Public Health Service Untreated Syphilis Study in the Negro male, Macon County, 1932 to 1972. Where did we go wrong? It is too early to determine in its totality what were the right and wrong decisions by our political leaders in response to the COVID-19 pandemic. No one has figured out how to stop the spread of the virus, nor has no one figured out a successful solution to keeping citizens safe. So the entire world is on its heels waiting to see what the virus would do next, which will then alert our leaders to respond. However, thus far, Alabama's response to the COVID-19 pandemic has been motivated by sustaining the economy, from reopening businesses to allowing contact sports to proceed in the state. These decisions are solely based on capitalism that seems to value profit before the safety of citizens. According to the Alabama Department of Public Health, Alabama now has 163,465 coronavirus cases with 2,653 deaths and counting. Yet, we are able to watch college and professional football this fall. So how did we get here? This question is best answered by highlighting A World in Disarray, American Foreign Policy, and the Crisis of Old Order, written by Richard Haas. This book is a scholarly prediction of what the world looks like now and in the future by using old foreign policy methods. Ironically, this book was published in January of 2017 before Trump's inauguration. Throughout this literature, Haas provided recommendations, instructions, warnings, and predictions about the old practice of respecting states' borders. There is one prediction in the book that has fully manifested into reality across the world. He mentions that global health is a rising concern in international relations, and due to the World Health Organization being ill-prepared and underfunded to meet global health challenges, such as pandemics, he states, an outbreak of a disease in one country can easily spread around the world. This statement by Richard Haas is an excellent transition into Monye Shaver's presentation regarding the international response to the COVID-19 pandemic.
Thank
Monye
you,
Shaver.
Theo. Yes, thank you, Theo, for that introduction. So I'll just get right into it. Initially reported first from transmission at a seafood market in Wuhan, China on December 31st, 2019. The coronavirus spread quickly in China and worldwide, as we see now. This global health crisis exposes the ramifications of globalization, as shown by the reports of 82 confirmed cases in 18 countries outside of China only a month after the first reported case in December. The World Health Organization eventually characterized COVID-19 as a pandemic on March 11, 2020, with over 118,000 confirmed cases in 114 countries and 4,292 deaths globally within 2 months after the first reported case in December. In response to this devastating global health issue, governments have taken various intervention measures, as Theo presented, to save the domestic and international economy, more so of a capitalistic approach. Amid the coronavirus pandemic, the state's limited role has subsided, and civilians and corporations are calling on governments to ease economic pressures from unemployment and an overall crashing economy. So you may ask, what went wrong? That's the purpose of this panel. Despite intervention methods in the United States and other countries, these measures were implemented months after the first reported cases by the World Health Organization. As shown by the rapid spread of COVID-19, the global economy's interconnectedness creates obstacles in slowing human-to-human transmission. According to the Taiwan CDC, on December 31st, an email explaining the atypical pneumonia was sent to the international health regulations under the World Health Organization, explicitly noting that patients were isolated during treatment. Although Taiwan did not directly state human-to-human transmission, the Taiwan CDC says, quote, public health professionals could discern from this wording that there was a real possibility of human-to-human transmission, end quote. Despite Taiwan's warning, the World Health Organization did not report human-to-human transmission until January 22nd, 2020. In addition, the WHO did not declare coronavirus a public health emergency of international concern until January 30th, 8 days later after they reported human-to-human transmission. These shortfalls are issues of concern and pinpoint the challenges in the international response to COVID-19. Although a pandemic wasn't deemed until March 11th, factors show COVID-19 met that criteria way earlier than it was reported. The sovereignty dispute between Taiwan and China that keeps Taiwan locked out of international organizations such as the World Health Organization has caused significant controversy. The World Health Organization issued a statement on March 29, 2020, claiming, quote, Taiwanese membership in WHO is up to the World Health Organization member states, not the World Health Organization staff, end quote. The U.S. State Department issued a press statement that condemns Taiwan's exclusion from the World Health Assembly, especially since Taiwan's handle on the pandemic has been exemplary. The United States, a leading funder of the World Health Organization and among the highest with COVID-19 cases, also issued a withdrawal from the World Health Organization effective July 6, 2021, due to its failed response to COVID-19. Issues surrounding information sharing and transparency, and because the World Health Organization declined to adopt reforms that indicate independence from China, are reasons why the Donald Trump administration wanted to withdraw, or actually are going to withdraw, supposedly. The United States plans to scale down engagements and redirect the fiscal year 2020 contributions. Remaining balance are an issue. The U.S. decision to halt funding is not only critical for addressing the corona pandemic, but support for other diseases viruses such as HIV, malaria, and tuberculosis. So at a time when countries like the United Kingdom, France, and Spain are enduring the second wave of corona, based on reports from the Wall Street Journal, and when presidents like Donald Trump tested positive for COVID-19, even after downplaying measures and joking about political opponents wearing masks the vulnerability of our healthcare, food, and education systems remain. So where do we go from here, as Martin Luther King Jr. would ask? Without question, institution building is a concrete way to better prepare for pandemics and other global health issues. There is no time for petty power politics. The global economy must act as a collective unit while battling infectious diseases and alleviate this pandemic and strengthen socioeconomic systems worldwide. As Theo mentioned before, states are going against the old world order, and they are intervening in their economies, and they are providing funds to the World Health Organization. We just don't want this to stop, and we don't want corruption to overshadow the pertinence, the importance of us building our healthcare, food, and education systems to overcome this pandemic. Thank you.
All right, Kendo, you're next.
I just went off for no reason. Okay. Okay, cool. So thank you so much to my colleagues. Like they said, the poor response to the coronavirus is something that could have been avoided. And ultimately, when we look at climate change and the reactions and the responses to climate change as an international global phenomenon, we'll understand that these responses are not a surprise and that there are more than enough evidence to show that Donald Trump is not prepared to essentially respond to this issue. So in this picture, you see him holding a sign that says Trump digs coal. And that is so backwards when you think about the Paris agreements that in 2019, he pulled the United States out of. And those Paris agreements were essentially the entire world coming together to recognize not only climate change, but the issues that will ripple from climate change if it goes unchecked. So contrary to common belief, climate change is happening whether you believe it or not. It doesn't matter who says that they do not believe in it. It's not a religion. It's not a story or a folktale. It is science, and it is something that is proven. So on the right, you see a picture showing what will happen if we rise from 1.5 degrees to 2 degrees. And we've already warmed up the Earth by 1 degree. So we're halfway to what some people are considering D-Day. The ultimate goal, a lot of people hear a lot of different dates that are thrown around between 2030 and 2050, but 2030 was like that year that if we could get things under control, then we know we won't rise. The global warming will not rise past 2 degrees. However, by 2050 is the actual date that we would have to get everything under control before we reach pre-industrial levels, right? So we already know science is showing us the changes and the effects that human interaction and the way that we do business, the way that we just operate in general today is not healthy for the environment. And so when we think about pandemics like the coronavirus, these are pandemics that people in the agricultural sector, the environmental space have been talking about for a really long time. But if you don't believe that climate change is the thing that is happening, you're essentially left out of that piece of the conversation of what would happen when it comes to fruition, right? When you have 2 hurricanes back to back, 2 and 3, 4, 5 hurricanes back to back in the Gulf Coast, you know that there's something different going on. So again, the loss of plant species, loss of insects, loss of coral reefs, extreme heat, and the sea ice freeze, all of these things will contribute to not only worsening environmental and agricultural situations like what's going on in California with the fires, but also growing social unrest. So understanding the relationship, often, especially in the United States, we equate security or notions of security to guns or military and things like that. But human security has many different dimensions. And if you see in this diagram here, those dimensions include food security, economic security, health security, political, communal, personal, and environmental security. understanding that you're safe no matter where you are or what's going on. And climate change, right, has specific responses and specific notions behind it that will compromise human security, right? With hotter climates, we see less food being able to be grown. When there's less food, you see situations like the uprisings that occurred in my hometown of Chicago. We see an increase in natural disasters, like I said, with multiple hurricanes in the Gulf Coast. You see more migration, not only in the animals that have to move around because of forest degradation, but also in humans, right? When you have a greater influx of migrants coming to the United States, which further contributes to social unrest. Ecosystems will shift, move, and adjust because the earth is not stagnant. It is a living being and it responds to how we respond to it. You also have an increase in human-wildlife conflict when humans spread and we take up more space than what we typically do. We then begin to kind of infringe upon areas where coyotes and deer and different forest preserves and wildlife conservation. So that also becomes an issue. And then you also see more opportunities for infectious diseases, right? So when you have animals that then have to shift their migratory patterns, they interact with other animals, other species that they would not normally interact with. For example, the wild boar. I don't know if people know about this, but wild hogs are running rampant all over the United States, and they can hold up to 27 diseases at one time. And so with climate change, they change their patterns, which changes the way that they interact with their animal environment and also the human environment for farmers and things like that, which ultimately trickles down to all of society. So ultimately, climate change compromises human security, making us all more susceptible to catastrophes like COVID-19. The data we see Hispanic and non-Hispanic Black adults are number one for obesity, diabetes, and hypertension. So when you hear coronavirus and they're saying people with pre-existing conditions, these are some of those pre-existing conditions that will make you more susceptible to coronavirus. You also see here different counties throughout the United States that have environmental justice issues where their air pollution is astronomically worse in some areas versus others. So if coronavirus is something that can be spread as it's an upper respiratory disease, and you live in a place that already has poor air quality, that adds to your list of susceptibility. You also see right here the COVID-19, the devastating impact on African Americans in Louisiana. We are 32% of the population. By we, I mean Black people, African Americans, but we have made up 70% of the COVID deaths. In Illinois, I'm from Chicago, 15% of the population, yet we make up 42% of the deaths from COVID-19. So we cannot separate pre-existing health conditions from the environment that we exist in that can contribute to these pre-existing health conditions, which ultimately make us more susceptible and more vulnerable to COVID-19. And so when we think about policies and how we can respond to this, ultimately it goes to follow the money. You know what policies are working for you when you see what money ultimately gets allocated to these different policies. So the Pentagon used taxpayer money that was meant for masks and swabs and PPE, personal protection equipment, but they used that to make jet engines and body parts and body armor, right? And in this picture, you see, this is essentially what people in Chicago are calling for the defund the police. This is a hyper-militarized police tank on the streets of the city of Chicago. These are something that you may see in an open war zone. There were 371 complaints lodged against Chicago's police in response to protests, and more than 50% of those complaints were for excessive force. Right. So we're seeing growing social unrest. All of these things are happening, and the ecosystem that coronavirus is creating is allowing for these injustices to come to light. Trump has pledged to send sheriffs and law enforcement to the polling places on election day, even though it wasn't really clear if he could do that or not. But it's just really speaking towards how the allocation of funds is being utilized, opposed to the preparation for not only coronavirus, but for other viruses that may come after this. We have no idea how this could mutate and different things like that. So for communities of color specifically, when we look at 2021 and beyond, we need to be focusing on policies that emphasize resilience. And by resilience, I mean not a Band-Aid that covers the issues right now, but actually builds a sustainable response that we can persevere and endure through whatever else climate change may bring to us. We have to move towards more local policies, right? When we see California being on fire, when 80% of the fruits and vegetables from that get distributed throughout the entire United States comes from California, we have to think, what does food security look like in a time like this? In Chicago, there were uprisings. A lot of the grocery stores that were looted have not opened back up. So this then creates more fragile and vulnerable states of security moving forward. We have to tap into larger frameworks of support, right? Environmental justice, coronavirus, these are international phenomenon. And in the United States, we would be fooling ourselves to think that we were the only ones that are affected by these things. We also have to engage the youth. Looking towards the generations that will actually have to live through these issues. When we see the effects of coronavirus after the shutdowns, after the quarantines are over, the mental health, these are things that will affect future generations. And if we do not create meaningful and impactful systems that will respond to these issues ahead of time, we're merely just pushing the ball and pushing it forward for future generations to have to respond to. And what's maybe most important is that we have to hold our imagination accountable. When we're thinking about something as abstract as climate change, we have to think outside of the box. We can use technology, but we cannot depend on technology. Ultimately, it's going to come down to our individual relationships between ourselves, our communities, and our communities with each other that ultimately make up this greater salad. I don't even like to say melting pot, but this salad of the United States. And so coronavirus is just one of the pandemics or one of the side effects of climate change. We have no idea what else may be coming, but with these 5 bullet points, I think that if we focus on these, we'll be able to build up our resilience and be more prepared for whatever is coming next. So I thank you all so much for your time, and I will be handing it off to Febra.
Febra Holston.
All right, thank you very much. Thank you very much. Toggle my screen here. It's not showing my PowerPoint, but I'll just go on without it. I think I can handle it. The nature of the global domestic response to COVID-19, what went wrong, COVID-19's impact on the African American community, and what we can learn from COVID-19. Those are the things that, as we call them, prescriptions. What went wrong? Well, there was a delay in the detection and response recorded in China, as Monye said. There was an overburdening of the local health systems where we just weren't able to provide the care, adequate care for those individuals. And there was a lack of coordination in the national response. There also was an unclear message from heads of countries that they really weren't telling what was happening and how it was happening, and perhaps maybe even what those individuals in other countries could do to prevent. There was a variance of information from the National Institutes of Health, as well as miscues from the Centers for Disease Control. And in essence, we really shut down our lives and our economy. And when we did that, things just didn't happen as we thought they should. And people were looking, and there was scarcity for all kinds of materials that we needed in order to be safe. We just did not stick to what we needed to do until the job was done. And as a result, just like today, we see our numbers increasing again. There was an absence of federal determination in stopping COVID-19. Now, the impact of COVID-19 on the African American community. The African American community has always heard a lot of misinformation circulating in our communities. And we talk about that information as well as Mr. Moore with the syphilis study. Many reports highlighted that African Americans are at higher risk for both being infected with COVID-19 and, once infected, having worse outcomes. I think that was also generated from the other presenters. And African Americans have certain conditions. We have a high rate of service sector jobs, and so we're there at risk. We rely on public transportation, another great risk. We also live in crowded housing conditions, and those housing conditions have less, those crowded housing conditions have several different generations. So you might have the young and the old all living together. There is less access to health care. And I know in the state of Alabama, and there are several other states that have not expanded Medicaid coverage in the states. And those states that did expand Medicaid coverage had a greater chance that those individuals would be eligible for health care. There are greater levels of comorbidities in the African American community, and I think we've talked about diabetes, hypertension. One that wasn't spoken of was obesity and chronic kidney disease. That those things are issues where people who have already the lack of health care, the lack of providing care for themselves, and there's a greater chance that the COVID-19 virus may inhibit their bodies. And then we have that increased likelihood of those poor outcomes. In addition, we have financial barriers where there are job loss. And those of us who know people who were those frontline workers, that many times those stores and businesses closed, and they were without the financial assistance that they needed. Also, the lack of health care, actually paid health care by many of those jobs that they did have. There's also institutional distrust and persistent legacies of inequities. And I think Mr. Moore also talked about that. Early skepticism surrounding African Americans' perception of susceptibility was also something that was impactful. That we thought initially that African Americans were not going to contract COVID-19, and that was so wrong. There is also a higher incidence of community spread where you have the multi-generational arrangements in living in these different areas in the community. There's also a lack of trust from some of the non-Black institutions that if they don't provide us with the adequate and the correct information, then we tend not to listen to them in future endeavors. The delivery of health information and that message by trusted stakeholders was not there initially, and we just didn't know. And we had to look at African Americans to come to the table and be prepared to help us understand what this COVID-19 virus was doing to African Americans. And then there was the delay in seeking care. So if you don't have insurance, you don't have a place to go, you may have to go to a facility where you have to wait, there's a less likely chance that you're going. And so when we have delay in health care, then that usually means that we have a worse outcome when we do finally go. And what we have is a need for targeted education and messaging by our trusted leaders. And that was something initially that we didn't have, but later on it actually started to show up, and we saw that people were helping African Americans to understand the COVID-19 and the impact that it has on African Americans. There's also a need to focus on prevention. That prevention is something that we need, and that it's something that I guess we'll have to look at the research that's coming out to determine what it is that we can do to help prevent COVID-19 impact again. And also there are many issues regarding the multiple methods of communication. In the African American community, we do have the ability to communicate, but many times we don't have the funding to purchase those ways of communicating, such as having the internet capabilities, that we just don't have that in our communities. Now, what can we learn from the COVID-19 pandemic and in preparation for future pandemics? What we've learned is that there has to be an interconnectedness in the nature of our globalized society and economies, and the constant proliferation of information on a multitude of media platforms that can quickly help us to see and find resources for our public health in the prevention of COVID-19. Also, COVID-19 represents a significant challenge to the public and our public advisors who are expected to perform key functions. Taking decisive measures to mitigate COVID-19 is another way that we can look at it. Making critical decisions regarding resource allocation and making sure that people of color have availability of those resource allocations. And as well as we need to look at handling overwhelming amounts of data. And in just doing the research, there is a wealth of data out there for everyone to look at. But if you don't have the capacity to do that, then it's a little bit more difficult for you to find those resources for yourself. We need a timely response, and that's of essence for making a difference between containing a crisis and allowing it to spill over and overwhelm our healthcare system, our public organizations, and their ability to function effectively. Unintended consequences may occur as rules that apply to routine operations quickly become outdated, that we need to keep up with the times and keep looking at resources and availability of those resources for our communities. COVID-19 represents a significant challenge to the public and public advisors who are expected to perform key functions. And those functions include taking decisive action, handling overwhelming amounts of data, making critical decisions regarding resource allocations, coordinating with stakeholders, and there are no easy answers. It will take time before we can evaluate and compare crisis governance strategies. Some of those strategies include communication, adopting a whole of society approach, implementing evidence-based strategies based on historical as well as current data. And there is a need for an early warning system for future crises, partnering with research labs and institutes on a global scale, as well as helping governments to adopt sound measures that will reduce the instance of unintended consequences. There must be a coordinated effort from the international community to meet the challenge of the next novel virus. There must be a global humanitarian response plan which addresses the issues of the virus. Early action to mitigate the virus is key. Implementation of comprehensive public health measures is a necessity. It is more than a health crisis, and it requires a whole of government and a whole of society to respond. This is a test for our governance systems, and our collective responses will shape the future of eradicating pandemics in the future. As a citizen of our global society, are you up to that challenge? Thank you.
Thank you, everybody. Thank you for all the panelists. That was very vibrant discussion of some really relevant issues regarding COVID-19. So thank you for sharing your expertise. For the next part of our panel, we're going to answer some questions. I'd first like to pose a question to each of you, and then we'll see what's in the chat for today's panel. So let's first ask a question of Monier Chavers. So one of the things you talked about was institution building. What does that mean?
I think Ms. Holston actually touched on a lot of great points in regards to institution building. One of the things that was, of course, as I mentioned, were a cause for concern was the human-to-human transmission and the reporting surrounding the human-to-human transmission. I believe institution building basically includes communication and transparency and also accountability. In order for us to have strong systems in place to respond to pandemics as such, there has to be strong communication between global societies. As has been shown with the COVID-19 pandemic, petty politics are getting into the way, and that hinders us from having strong institutions that foster communication and engagement, and also help us to implement initiatives to mitigate challenges from pandemics. So I think institution building basically means that being transparent, being open, being communicative with everyone, and not letting their sovereignty issues or their religious beliefs get in the way when there is a global crisis that affects everyone, especially in the midst of globalization. And Theo hit the nail on the head when he said that Richard Haas, he said that global health crisis would be an issue for us because of our interconnectedness. So I think us knowing that, we should do everything that we can to support the World Health Organization, and also to let them know that they did have a delayed response. But that doesn't mean we should take away funding. That means we should implement measures to build that institution so they can have that extra support. Thank you.
Thank you. So then this question is to Theo. So the next question is to Theo Moore. So Mr. Moore, you talked about the role of the World Health Organization and the accusation that they were delayed in their response. But one of their um, uh, replies to that kind of criticism is that they depend on member states. They're member countries. They don't gather the data on their own. They put together the data and disseminate data that they get from the countries that are members. If they don't have that data, then they can't announce or inform the world. Do you think that the criticism against the World Health Organization is fair, or should the blame rest on the member states?
Good question. In my opinion, I believe that it's not fair. Like I mentioned when I actually mentioned the book by Richard Haas, the World Health Organization is underfunded and also kind of ill prepared. But they're basically depending on other, like you said, countries, and to actually they depend on other countries to actually get their data and things of that nature. And so I believe that it's actually not fair. It's actually not fair.
Okay. So to Federal Hostin, you talked a lot about the role of lots of institutions in the COVID-19 response. What do you think the role is of the Black community itself, of underserved communities, to build their own infrastructure and to take a larger role in informing their own populace about things like pandemics and recommendations from institutions like CDC, the World Health Organization, etc.?
I think traditionally that African Americans really have been left out, and that we do have to form our own methods of informing our fellow African Americans. That is something that we know that may be difficult for us, but it is something that we realize now that we have to be doing something in our own best interest. That there may be others, and there may be health facilities and centers, but regardless, we still need to depend on African Americans, those who are able to provide us with that kind of information, to help provide that information for our communities. It's almost as if in in regarding the syphilis study, that there were African Americans who were required to do certain kinds of tests and not give certain kinds of information. But the reality of that is that there has to be somebody else that's going to take it on themselves to provide that kind of information for us as a people, because we may not be able to learn it on our own.
That's interesting. Annually, the descendants of the men involved in that study come to Tuskegee University in the spring. And one of the things that they've put together through their Voices of Our Fathers nonprofit group is a forum for helping other people not fall into those same types of deceptive practices. And so they would speak to what is Tuskegee's, one of Tuskegee's historical mantras, which is pull yourself up by your bootstraps. That to a certain extent, we need to build our own places of information, places of trust, and not always rely on people outside to come in. Let me open that up um, for someone else to respond to that. Ken Doe, would you please speak to that? To what extent do we bear responsibility for the fight in which we found ourselves as underserved, underrepresented, underrated communities?
I just want to make sure I understand the question. You're saying, to what extent have we essentially contributed to our situation that we find ourselves in today? Is that what you're asking?
No, I'm asking actually the opposite. To what extent do we have a responsibility to build that infrastructure and those information centers ourselves instead of reliance on governmental systems and other institutions?
Oh, definitely, definitely. I think it's interesting. I was just listening to, it's an old album by Common, the rapper, B. And on the end, there's like a spoken word piece, and he says, "Be cautious about asking a nation that was built on free labor for reparations." Right. So essentially, how can you ask a group of people? How can you ask a society that has systematically kept you under its boots, kept you in, I guess, a situation that may be deemed undesirable? It's unrealistic for us to look towards any system outside of a system that we build for ourselves to save us, to help us, or to contribute to the shift in our situation in any capacity at this point. I think, and a lot of people, I think a lot of people are looking to Trump right now, and he's kind of the scapegoat for Americanism overall, right? Trump and the things that he's doing, the things that he's saying, and the actions that he condones is not individual to Donald Trump. It's not individual to this microcosmic view of America that we're seeing right now. This is the energy that America has always had, and in my opinion, it will continue to have until we put ourselves in a position of power and we create the systems around us, and we create the systems around us to support our own self-determined outcomes and initiatives. So on the last slide that I had, I said that we need to definitely focus on more local scaled operations. And so what that means is that everything is contextual. When we talk about intersectionality, I pointed out, everything is contextual, and you have to be willing to look at your situation for what it is and not assume that anybody else knows what your situation is or that they're considering what your situation is. You have to understand your situation, and you have to manage your situation and essentially take control of your situation. I think that's what our community needs to do.
Right, to
And I
Theo
just want to
Moore.
add to that. I'm sorry.
Go ahead.
Dr. Alexander, that was a great response, Candace. And I just want to add to that. That's why I believe personally an Afrocentric lens is important, because it helps us to use our worldview. To utilize the worldview that's based on our customs, our civilizations, just our aspects in general when we're creating alternative methods to basically refute this subservient position that we've been placed in. And it's not only with African Americans, it's on a global international scale, which is why I believe Afrocentrism is very important in academia, and it translates into the research that we have and the policies that we create. So I think basically what Candace says, supporting our local systems, and the best way to do that is to use a worldview that is not racist and that appeals to the customs of the African diaspora in general.
So Theo Moore, we'll let
Amazing.
you jump in since everybody else has responded. What is our responsibility as a underserved community in producing our own systems for education and trust?
Well, I'm gonna jump into it from a historical lens. We have seen our ancestors actually put systems in place. I mean, we're at Tuskegee University, and this is a big blueprint in regards to how to, create our own systems and of education and things of that nature. We have the extension program and things of that nature. And so we don't really have to reinvent the wheel. Like our people have been doing this for actually decades. Well, not decades, centuries. I mean, since early 1900s. So we just have to actually, like we said, like Maya was saying in regards to education, we just have to learn about these things and actually learn the blueprint so that we can stand on a solid foundation and build upon that because our people have done this before. We just have to know that they have done it. We don't know that, some of these amazing people, especially at Tuskegee University, that has set the tone for the nation. And so we just have to actually look back in the rearview mirror a little bit, before we actually go into the future because it's a lot to learn from our past.
All right, let me ask another question that's kind of open. Mr. Moore was very critical in his response to the state of Alabama and the governor's policies and how they sort of rolled out. To what extent do you think that state responses have been mitigated by the federal stance on COVID prevention and safety and the use of things like PPE? But how much do you think that mitigated the state's response? Let's start with Mr. Moore and then anybody who'd like to respond.
That definitely influenced the Alabama's response. I mean, we're in a red state, right? And from a majority standpoint, they're supporters. We are supporters of Trump in regards to the state. Are supporters of Trump, and as you can see, especially from last night, he has no actual respect for what's going on in regards to COVID-19, and he actually caught COVID-19, and in that town hall town hall speech, whatnot, he still didn't have on the mask. And as it trickled down to this state, Alabama, you could just tell that the response was, hey, let's do a little bit at the time, keep the economy going, things of that nature. And so it was definitely, from what I can see in the response, it was definitely to make sure that Alabama sustained the economy, and at the same time, the numbers are steadily growing. We have football going on, and coaches catching COVID. Everybody's catching COVID during the football season, and it's interesting just to see how we're reacting to this, and hopefully we don't go down in history as what were they thinking, during this time period. People playing football and it's a pandemic going on. So that's my take on it.
I definitely agree. I definitely agree with you, Theo. I think there has been intervention measures, I guess, in place, but they've had a capitalistic approach, right? It's all about saving the economy. I didn't hear much about welfare. I didn't hear much about social services. In the United States, we received one stimulus package in March, and it's now October, and they don't want to send another one. So I feel like there needs to be intervention in regards to social services, things that are impacting healthcare, essential workers, education, food. All of these issues are critical and important, and they also help to foster institution building. I feel like if the federal government isn't taking these things serious, then states aren't going to take them serious. Just as we've seen, some states they even closed down or shut down their economy since we've been deemed a pandemic, since COVID-19 has been deemed a pandemic. So I feel like if there isn't any, if your leader, the president, isn't taking measures for COVID-19 seriously, then I doubt that it would translate to a lot of state representatives or state government officials that support that leader. And that's just my position on it.
Well, my position is that the state is looking at the economy, and that's something that the tax base that we use, the taxes that we have that are minimal to an extent, that we don't tax as some other states do. So we depend on those economies, and it was important that it be seen that those economies reopen. And regardless of what the frontline workers and the possibilities that they may contract COVID-19, that our government here in Alabama was looking at the economy and money, the dollars that we would be losing if we stayed closed.
All right, Kendall, I'll give you a chance to speak to it.
Yeah, I think this is where, again, I'm going to challenge everyone to really hold your imagination accountable, right? If you cannot imagine a society that will not sacrifice its citizens for its economy and everyone is okay, if we can't imagine that, then I think our situation is a bit more dire and we're in more of a crisis than we recognize. Anytime a state is willing to sacrifice people, I remember seeing was the mayor of Las Vegas talking about, well, pretty much I'm not going to be the one who's out there. These things have really nothing to do. There's a total disassociation from the frontline workers and the people who shop in the grocery stores that these frontline workers work in, and we see the same thing in the food system where in California, again, there have been where you see fields on fire and there are still migrant farm workers in the fields picking as fast as they can because their livelihood depends on this, because they know that their lives are not valued and that their lives are only valued based on how much they can pick and how fast they can pick before this natural disaster comes and takes them out. So I think we are at a critical stage in the United States of America, in the world, where if we cannot put our economy aside, if we cannot put our selfish, at the end of the day, it's a selfish desire. If you cannot put yourself aside and think about other people, then we're seeing something that is going to ultimately change the course of the way we interact with each other, period. Because again, climate change is an international phenomenon. It affects everybody. Unless you're in the International Space Station, you don't have to breathe this oxygen down here. You don't have to eat this food down here. You don't have to drink from this water down here. This problem should matter to you. And as long as we keep allowing this elusivity, people being sneaky, just the government doing whatever they want and sacrificing people, I think we will continue to see civil unrest. We will continue to see people taking a stand in whatever way that they deem a stand should be taken. And I think that nobody has the right to judge those people, because we're entering a new time, and we have to hold our imaginations accountable for the prosperity of this new world order that we're ultimately moving into.
So it looks like everyone agrees that we have a trust issue. Trust is super important. Trust of the places that are supposed to be coming up with the data and sharing the information. And then there's a certain amount of trust for each other. I mean, even if we make policies, you have to depend on each person to comply with the policies. So even when the governor rolled out policies for safer at home, even when the federal government, or at least the science agencies delivered or made recommendations about how we could stay safer during this pandemic, not everyone complied with the policies. So even in stores that have signs that say face masks are required, on any given day, at any given time of day, you walk in and no one's wearing, very few of the people are wearing face masks. And as the pandemic, continues to now not just slow down, but gain traction, what you're seeing is the coronavirus or COVID-19 fatigue, where not only are people not complying, their compliance is falling off. And the longer we have to deal with the pandemic, people get tired of staying home. So we have to not only develop better trust, but we also have to trust each other. Everybody has to abide by the recommendations if it's going to work. And then lastly, that we have a responsibility for not only our own messaging, but our own infrastructure building. We have to build the institutions in our community that then we can hold accountable for the messaging, for putting things in place to help keep us safe. Can't depend on somebody else. That somebody is us, right? We are the ones who bring change. I'd like to thank all of you for your time today and your expertise. This was a great panel. Thank you so much for participating. Goodbye.
My my education is well worth anybody's while, but to sort of get that, physically in the form of a scholarship that not only pays for part of your college, but all of it, is sort of very rewarding, and it makes me want to strive so much harder to live up to that scholarship that was given to me.
It was fall of my sophomore year, and my parents told me that they could not afford to attend here. I had loans piling up, and my parents said, you can either just not be in school or you can come to Texas and go to a school back at home. And I just knew that I was deserving of being here. I had a 4.0 GPA, I was an eminent scholar, and I knew that God put me here for a reason. And so I started sharing my story and just advocating for why I deserve to be here. And scholarships started falling in my lap, and I became an RA. I became a university ambassador, and I made it known that I was supposed to be here, and everything ended up working out.
I think just the fact that someone else is paying for my schooling, and I've always thought that school, if you're going to be at school, you shouldn't be wasting your time or money anyways, but the feeling is more heightened when someone else is paying for it, and you feel a responsibility to not let them down or not let their money go to waste, like you would feel if your parents are paying for it, but even more so for something that you don't know.
It lets me know that I can't stray away from those responsibilities, or I might potentially lose that scholarship. It also lets me know that I need to be a walking example for my peers, because if I show a great deal of work ethic, then that'll probably, lead them to follow me in the path that I'm on, which is the positive path.
I can focus more on schoolwork without, the financial burden or constantly thinking about, okay, what about next semester or the semester after that? I know that I'm able to be here and I'm able to stay here and focus on my schoolwork, and also indulge more in extracurricular activities. For example, like the University Ambassador Program. I'm able to do that because I can focus more on my schoolwork and be a part of more things. Also, do more extracurricular so I can set a good example for my siblings, because they mean the world to me.
I feel as an HBCU, African Americans should always be lifting African Americans up. And when I graduate and I'm an alumni here, I would be more than willing to give back, because I know the feeling that I got when I received my scholarship and was told that I had a full ride to this university is something I will remember for the rest of my life and can never be replicated. And I'm more than willing to give somebody else that experience in the future.
I just want to say thank you so much for what you did for me. Just from the bottom of my heart, I appreciate it so much.
Thank you. You've not only enabled me to have an easier time receiving my education, but also my parents as well.
Thank you 1,000 times, thank you. I know that I wouldn't be here without all those scholarships. And I know that I appreciate it, but other students appreciate it. And that, we wouldn't be here without those scholarships. And we know that we're gonna make you guys proud, and that we can make something of ourselves with that money. So, thank you.
All right, Golden Tigers, take out your cell phones. Now's your chance to support our university from the comfort of your home. It just doesn't get any easier than that. We might not be together in person, but we can sure enough send our support for our students this homecoming. But we can't do it without you. So join our Text to Give campaign this weekend by texting GIVE, HOCO, to 41444.